I think it's a pretty exciting time for us as physiotherapists. We've got new research directions and emerging paradigms which are trying to entice us into having a look at what they have to offer and implement them and adopt them in our practice. Now, I think most of us here and who are on the webinar trained in the biomedical model, and we've enjoyed many clinical success stories, I'm sure, but equally we can all probably recall patients where we have explored avenues and exhausted the biomedical approach, or we've had successes which we were seeking but probably failed to be able to fully explain why these changes have occurred within that paradigm. So tonight's an opportunity for us to consider other paradigms that may help to expand our biomedically trained minds. And I'm going to use the example of the management of the sporting hip to illustrate how some of these paradigms might be applied in the clinical setting. Now, sometimes this can be quite confronting as we look outside of our square and how we trained. So it might be a little unnerving or make us feel a bit unsure or uncertain about how we might apply these things. But hopefully by the end of tonight's talk, you might feel also excited about what it might have to offer for you and most importantly for your patients. So as sports physiotherapists, we could probably consider that one of the roles we have to play is to assist the athlete to return to or remain in their chosen sport with maximum capability to respond and adapt to and take on the environmental and task demands that their sport is asking of them. Ask her to try and let that go, all right, and hold through there. And what you will often find is that as the areas that are dominant and want to take the load release, then you get this quiver where I think you're getting into some of those deep sort of areas that will hold from there. You can then actually work on a reciprocal roll on the ball. You can hold that position and draw a figure of 8 with both legs, which is quite hard. And then that you can actually you might find a part of the or quadrant of the movement that's actually quite hard to control and to maintain the transverse plane rotation or pelvic tilt, some of those sort of features.